community education.
I'm Lou Maglio, a live demonstration of one of the hottest methods of wrinkle removal, but is it right for you?
We've all talked about the birds and the bees, but you'd be surprised how many people...
With your new Olds Connection dealer now.
Do you want to lose those frown lines between your brows?
Who doesn't? Well, there is a quick in-office procedure that may do the trick for us, but are Botox injections really safe? We sent Fox Family Health reporter Lou Maglio out to find out. And Lou, we're talking about what a kind of a poison, so to speak.
Well, you sure are, guys. That's exactly right. Botox is a very hot deal in the area of wrinkle removal these days, but a lot of people are concerned about it. They're wondering, is it safe? And here's the reason. Check out the bottle. It says botulinum toxin. Botulinum toxin type A, and we all know that botulism is a disease, and it's a dangerous disease. So the question is, why would anyone want to have this injected under their skin just to remove wrinkles? Got the answer here. This is Dr. Michael Watnowski. Doctor, tell us about the risks entailed with this Botox, and you waited a while before you decided to enter the fray and start using it.
Right. Botox, or botulinum toxin, is a substance that comes from a bacteria. Just like people perspire or sweat, bacteria make a substance which is called an exotoxin. And if you have food poisoning, that's called botulism, and that can cause major problems for you. But the toxin that comes from the bacteria is modified chemically to a very, very dilute chemical strength, so that when we inject it with very minute amounts so that it's not harmful to anything physically from top to bottom of the body. It's only harmful to the area that you're injecting it.
All right, we've got Lynn Wagner in the chair here. She's ready to get her shot. What about you, Lynn? When you heard botulism, were you concerned? You've already had one treatment. I'm going to do more today shortly. Were you concerned about that word, botulism?
No, not really, because I'm in a skilled professional's hands. I trust him, and I know that he wouldn't do anything to hurt me. And no, I wasn't afraid at all.
All right, we're going to get going on this. We want to tell you we're at the Ohio Clinic for Aesthetic and Plastic Surgery. Dr. Watnowski is the big cheese over here. Doctor, give us the play-by-play now as you start doing this. What are you looking for, and how does it work?
Okay. First thing we do is, in the areas that we most commonly use botulinum, Botox we call it, injection, are in the frown line areas. Go ahead and frown for us, Lynn. And you can see these lines that occur, and these lines occur because of muscle activity. And there are two sets of muscles in the forehead area. Frown again, please. There's a muscle right in this area here, and there's a muscle right in this area here, and then there's a muscle right in here. And those muscles are those bulgy areas, and when you contract those muscles, it makes the line here and the line here. The other area that we use it very commonly are the squint lines, or the eye frown lines. Frown for me, squint. And you can see these lines that protrude out from the eyelid. And these lines are caused by muscle contraction. And if you do it enough over year after year after year, you begin to get lines from the muscles. So what I've done here is I've marked out, Lynn, squint again on this side for me. I've marked out the areas where we're going to inject the Botox substance. And basically we inject a very minute amount of this substance into the belly of the muscle. And what that does is it begins to work right away, but it takes about a week for it to take full effect. It causes a local weakening of the strength of that muscle, so the muscle won't work to the same degree. And what happens is these frown lines lessen or disappear totally for a temporary period of time. That's usually about 3 to 6 months.
We've only got less than a minute left, Doctor, so let's get to the shots now. So it lasts about 6 months, and as you're doing this, let me ask you some more questions. Sure. It lasts about 6 months, so every 6 months you have to come back. What's the cost involved in that?
It usually is about a $600 cost for the injection of the area or areas that you wish to inject. Now, Lynn, why don't you close your eyes for us here? And what we're going to do is we're going to begin to do the injection here along the muscle area.
Anybody this is not for, Doctor, and are there any side effects? I know droopy eyelids occasionally a potential side effect.
The important thing is that the patients do not rub or manipulate the area that we've injected for a few hours after the injection. And the reason is that you can rub the injection so that it goes into the muscles next to the muscles that you want, meaning it can go into a muscle that you don't want it to go into. And it can cause a weakness of that muscle.
All right, we're not going to show any tight shots. We do have a little bit blood loss, but that's the way it goes when you give people shots, right?
Just a drop or two of blood, just like when you get a shot.
And Lynn is feeling pretty good about this. You're not in any pain whatsoever.
None whatsoever.
All right, you're loving it.
We use a very, very tiny micro needle. It's a very, very tiny needle. You don't really even feel it go in. And the substance that we inject stings just a tiny, tiny bit right after we inject it, but really not of any great degree.
Wayne and Macy, it is not for everyone, but it's for a lot of people. Botox very hot these days. Lynn is very happy with it. Doctor says it's out there, it's popular, it's very safe. So if you're interested, give the folks out here, some of the other centers in town, a try. We're at the Ohio Clinic for Aesthetic and Plastic Surgery, and this is Dr. Watnowski. And Macy, you don't need this, but maybe Wayne, maybe you do.
I think
know
I do. I definitely do, Lou, but I can't afford it.
Well, it does cost a little bit of money, but it's an investment that people who take it say, hey, it's well worth it.
All right. Thank you very much.
Why in a Passbook Plus account?